Madam Speaker, it's very tempting. Mr. President, members of the board, delegates, and guests, may we never again have an election quite like that. But now that it's over, we do congratulate all of the newly elected. We commit to work with all on behalf of patients and their physicians. The intended genius of the United States, reflected by this House, is not that we all have to agree on each issue, but we have a forum to debate our disagreements before a vote determines our course. And in this work, let's not become blocked by needless worry that steals energy or sidetracks. A quick story. Early in my days as dean at University of Chicago, I thought it might be good to have a faculty cocktail reception to celebrate the upcoming academic year. I arrived in the big tent set up for the occasion to find some 300 faculty, sipping wine, quietly chatting, but with a lot less noise than I'd expect, and a mood that felt just a little bit strained. So I asked a couple of people what the deal was, and they told me that an unusual gathering like this is only called when a shoe is about to drop. So they were anxious to hear what was coming next. I had fun going to the microphone with downcast eyes, looking as dour as possible, and then cheer up to let folks know we were simply there to celebrate, build community, have some fun. And I have to say, things really picked up. And watching the next hour as the wave of noise steadily rose over the tent, I noted that released anxiety is a stimulator of thirst. The tension from this election brought back memories of that night in the tent. Anxiety about the future, perhaps even a dollop of dread. We have work in front of us for sure, but let's simply focus on our task. Our country is comparatively solid. In fact, most other countries would happily trade for our strengths. And that's one of the reasons that despite political divisions in this country, the AMA has always and will always commit to working with all elected bodies and appointed agencies on a bipartisan basis. Democrats, Republicans, independents, political appointees, and career civil servants, and work toward advancing the mission that I so love to recite, to promote the art and science of medicine and the betterment of public health. Now, others take note of this attitude. The AMA recently was lauded for our bipartisanship by the well-known public relations and communications firm APCO Worldwide. Their annual survey of the 50 most effective professional associations in the United States ranked the AMA first overall. Now, first overall, not just in the healthcare sector, where we've always been strong, but across all industries. The survey included health organizations such as AHIP, Pharma, the American Hospital Association, but also groups like the U.S. Chamber of Commerce, the Business Roundtable, the National Association of Manufacturers, 50 of the most visible associations in our country. The 15 characteristics they surveyed, what research had shown to be the most reliable measures of effectiveness, included bipartisanship, self-regulation, coalition building, membership mobilization, stakeholder communication, and being good stewards of the industry's reputation. And that's just to name a few. Among these 15 characteristics, across these 50 prestigious associations, the AMA ranked first in 8. No organization had ever achieved that before. In 6 of the remaining 7 categories, the AMA ranked second overall, better than 48 of the other 50 cross-industries associations. Now, how good is that? Consider that we finished second overall in the category of social media and modern communication. The only group to beat us, the Internet Association. As a result, we were invited to Washington, D.C. to meet CEOs of these other organizations and share how the AMA was achieving this high degree of efficacy. And I have to say, this overall is a remarkable credit to our team at the AMA, to the oversight provided by our board, and to the work of and thought leadership in this House. Congratulations to all. The AMA was recognized in other ways in 2016 as well. From President Obama's shout-out praising AMA's work on opioids, to the state medical societies in Colorado, Georgia, Florida, thanking us for our efforts to block the insurance mergers. Here's another example. At the annual Health 2.0 conference in Silicon Valley, which is a conference focused on emerging technologies, a professor from Yale came up to me and said, "You know, there's a lot of noise at this conference. One has to search for the signal. But it seems to me the AMA is producing all signal and no noise." That was great to hear. The AMA contributed to that meeting in many ways. I was interviewed on the main stage about my remarks from our annual meeting, where I used the provocative term, digital snake oil of the 21st century. That, in fact, was an easy exchange, since physicians celebrate progress in digital health that produces great tools. Now, at the same time, we don't hesitate to call out those products that are unhelpful and may even be harmful. For example, a blood pressure app, which actually failed at high rates in detecting high blood pressure. Yet for 2 years, this was one of the most frequently downloaded health apps. A regulatory framework for this digital field is needed, and we hope to work with stakeholders to make that happen. Additional success was our monumental breakthrough to repeal SGR last year, which laid the foundation for our work in 2016 to both improve MACRA and to create tools to simplify transitions for physicians. Work done across our units of professional satisfaction, advocacy, communications, and IT, and also making use of our recently enhanced digital capabilities. We developed a number of tools, such as the MACRA Action Kit, our Payment Model Evaluator, and our now award-winning Steps Forward modules. Some of the AMA digital tools are recognized by CMS as fulfilling practice improvement requirements. Also, Dr. Gurman has already celebrated the revision of the Code of Ethics. And as I mentioned earlier, one of the recognitions the AMA received from APCO was for self-regulation. Elements such as the code undoubtedly played a part in that. And we've also made education a cornerstone of our success. New AMA education products and tools are helping physicians across specialties earn CME credit. We believe that when physicians obtain CME, they should feel that pragmatic, practical learning applicable to their practice was achieved, not that they wasted time on topics of questionable value to their specific practice. And our consortium of 32 medical schools working toward building the future of medical education continues to leap forward. 1 month from now, our textbook, Creating a Third Field of Science in Medical School, Health System Science, will be released. The announcement of the release last week received substantial attention. This nascent field will enable a systemic understanding of healthcare and thus comport with the shift in disease burden, which has occurred over the last half century, that shift being from dominantly episodic to dominantly chronic disease. This new health system science will be adopted in the AMA consortium, and I believe without doubt will spread to curricula across the country. We're seeing in all of our work that our greatest impact results when we have strategic partnerships and alliances. In 2016, we partnered with the American Heart Association, the CDC, and others to improve health outcomes in prediabetes and hypertension. Common chronic diseases such as these account for more than 80% of healthcare spending. We work nationally and across dozens of states to expand access and enrollment in effective diabetes prevention programs, DPPs, including an innovative scaling statewide partnership in Michigan focused on communities at high risk. By the way, special thanks to the Michigan State Medical Society for its critical involvement in this project, along with more than 40 other Michigan organizations. We applaud CMS's landmark decision to expand coverage of the Medicare DPP model to Medicare patients at risk for developing type 2 diabetes, underscoring the value of prevention in reducing healthcare costs. This CMS decision also highlights the success of our own 3-year DPP work in partnership with the YMCA of America and the Center for Medicare and Medicaid Innovation across 8 states to increase physician referrals for patients living with prediabetes. Also this year, we launched a national ad campaign to raise awareness about the dangers of prediabetes and encourage people to take our online quiz that we constructed to assess their personal risk. The result of this ad campaign? Already, 250,000 people have assessed their risk using our tool. More than 700,000 people explored the information on our online site. This ad campaign was a partnership between AMA, the CDC, and the American Diabetes Association, along with the Ad Council. The value of media donated to our campaign has already surpassed $23 million. A great example of the leveraging power of partnerships. Throughout 2016, we expanded our innovation ecosystem to bridge the digital divide for physicians and began to address the immense problem of fragmentation across our disconnected healthcare non-system. We both attracted and collaborated with tech innovators and entrepreneurs at Matter in Chicago, a healthcare incubator for more than 120 companies. And this past January, we launched Health 2047 in San Francisco, an innovation studio that has attracted outstanding talent in Silicon Valley. The overall goal is to design and develop technologies optimized for more efficient, effective practices and continuity of care, and of course, better health. And this fall, we launched the AMA's Physician Innovation Network, where physicians and entrepreneurs can connect and collaborate on developing healthcare solutions. Think of it as eHarmony for physicians and entrepreneurs. So what's AMA's overall goal in creating these opportunities for innovation? What's our mile marker? It's simple. Through this work, we aspire to save every physician 1 hour a day, every day of the year. Over the last few years, the AMA has made a series of bold decisions. Decisions that have tangibly increased our standing and visibility nationally. Our work to create the medical school of the future, to better health outcomes in chronic disease, and to improve professional satisfaction, all have real traction, have produced innovative products and tools that now can be expanded in the service of patients and physicians. Many external validators now recognize that we are living the mission. And we are now developing additional new bold ideas, ones that I will discuss in the future, but ideas that will make practicing physicians acutely aware, day by day, of the strong career ally they have in their corner, that ally being the AMA. When I traveled to DC in September to explain how the AMA had suddenly become this model for effective associations of the future, the subsequent discussion settled on the pillars that make exceptional leadership associations. And these included, first, performance aligned with high expectations. Because clearly defined high-impact moonshots drive work that is highly ambitious. Second, to recognize the value in relationships and accomplish tangible, real results through partnerships. And third, have a narrative that drives success, but a narrative that also rings true, since the basis for that narrative are those real results. These pillars now characterize your AMA, which was referred to at that meeting as the AMA model. A model that I believe will come to epitomize what a 21st century association can and should be. Thank you.
Thank you, Dr. Madara.